Hello, I am Dr. Nupur Gupta, consultant gynecologist and obstetrician practicing in Gurgaon. Today I am going to talk about cervical cancer and its prevention. We all know it is one of the very common cancers amongst females all over the world, especially in developing countries. It is more common than developed countries because of poor maternal health. The patients don't want to go to the gynecologist. There are no guidelines which they know about, and they can go for screening for cancer. There are various symptoms that women should know that how cervical cancer can be diagnosed and when is the right time for them to report to their gynecologist. Especially women, it can happen at any age, and especially in women who are sexually active, who have multiple sexual partners, who have been infected with human papilloma virus at some point during their life, and who have irregular vaginal bleeding, who have bleeding after intercourse, which is called postcoital bleeding, who have intermenstrual bleeding, or sometimes they have a foul smelling vaginal discharge. These are all the symptoms which should prompt any female in reproductive age or during menopause, post menopause, to come to a gynecologist and go for screening. There are various guidelines which are developed in UK, in US, and world over, and especially in India also, for females. When should a pap smear be done in any female is every 3 years after 3 samples are negative in 3 consecutive years. After the age of 60 to 65 years, we do it every 5 years, and so on. So women don't need to fear about cervical cancer anymore, because nowadays the research has led to development of a new vaccine, a new innovation in healthcare, which is vaccine against human papilloma virus, which leads to this kind of cancer in females. It can be given to adolescent girls from 9 years of age onwards, and nowadays it is also part of Indian Academy of Pediatric Immunization in India. In some countries, even boys are given this vaccine because this virus is known to be transmitted from male to female. Up to 26 years of age, any woman is eligible to take the vaccine, and also women above 26 but who are not sexually active and have never had intercourse till date. But taking the immunization does not mean that pap smear need not be done. Still, pap smear screening is mandatory to detect cervical cancer as far as possible. So now we know that cervical cancer is preventable. There is a vaccine which is available. There is pap smear that can be done in women who are sexually active. So if you want to know more about this cancer and prevent yourself being affected by this kind of cancer and go for screening, you can consult me on Lybrate.com, which has all modes of consultation, audio, video, or a text mode of consultation.